Hello, everyone. My name is Nevin Akaydın. I am a librarian at Santa Clara City Library. I am with Alessandra Pio de Ceballo from Habitat for Humanity, East Bay and Silicon Valley. We are hosting these programs every first Thursday of the month until December. The first one is Your Guide to Benefits and Financial Assistance. Alessandra?
All right, thank you, Nevin. Well, welcome everybody. Thank you so much for joining us. Again, my name is Alessandra, as Nevin said, and I'm a housing counselor at Habitat for Humanity, East Bay, Silicon Valley. I want to thank Nevin and the Santa Clara City Library for hosting me and for giving me an opportunity to present our Your Guide to Benefits and Financial Assistance webinar. And you get to hear this first because this is a brand new webinar for us. So welcome really to our first presentation. I wanted to let you tell you just a little bit about who we are and what we do. Habitat East Bay Silicon Valley is a nonprofit, and we serve people in Alameda and Contra Costa and Santa Clara counties. And we do this through 3 programs. First, we offer affordable homeownership opportunities. We build new homes, and then we also renovate existing homes, and we sell them at an affordable mortgage to qualified families with limited and moderate incomes. We also offer housing counseling services, and through our owner-occupied home repair services, our home preservation program provides grants and low-interest loans for low-income homeowners throughout our service area. And you can find more information on all our 3 programs on our website. And at the end of the presentation, I'll have our contact information. But I also wanted to let you tell you a little bit more about our housing counseling program. And our housing counseling program is approved by the U.S. Department of Housing and Urban Development, also known as HUD. And our services include one-on-one counseling with a Habitat HUD certified housing counselor. The service is for anyone wanting to learn how to gain control over their personal finances, whether that means learning how to create a working household budget or manage debt or build savings, repair or improve credit. And for those whose goal is homeownership, we also offer pre-purchase counseling to help them understand how the home buying process works and what they can do to become financially ready for homeownership. As part of this program, we also offer financial education webinars like the one you're hearing tonight on a variety of topics that range from how to budget, how to understand credit reports and credit scores, how to manage debt, how to protect yourself from ID theft, and pave a path to homeownership. And then we also teach the HUD-approved 8-hour first-time homebuyer class. And last but not least, we offer a free online financial education center, which is a free online library of interactive lessons that you can take at your own pace and at your own time. And they cover a variety of financial education topics. And at the end of the presentation, I'll have a little bit more information about this as well. Now, if you need help meeting basic living expenses, you may qualify for benefits and programs that can help cover food, housing, medical, and other costs. Now, today, we will review cash aid, Social Security and disability benefits, housing and living cost assistance, low-cost healthcare services, employment assistance, unemployment insurance, and then we'll go over some resources for people ages 60 plus. Now, we also have a quick disclaimer. Habitat East Bay Silicon Valley makes no warranties or recommendations about any of the services or resources that we will review today. The programs may change, and you need to check with the individual organization for updates on the services they offer. Now, you're going to be receiving a handout when you get the email that Nevin was talking about a little bit earlier with all the programs and services that we will review today. And now this PDF document includes links to websites and programs, so make sure you do take a look. Each program has its own eligibility requirement. Today, we're going to be doing a general review for each program. So to know whether a program is for you or to know more details about it, then just click on the links to learn about what they offer and what the eligibility requirements are. Okay, so connecting to programs and assistance. Now, there are federal and state websites that help you connect to benefits, programs, and services. For example, benefits.gov is a US Department of Labor website where you can find information on over 1,000 government assistance programs, check your eligibility, and learn how to apply. The US Department of Housing and Urban Development, or HUD, is a federal agency and is responsible for national policy and programs that address America's housing needs, including enforcing fair housing laws. Now, on its website, you can look for rental assistance resources, as well as information and resources about other housing-related topics. My Benefits CalWIN connects people to applications from Medi-Cal, County Medical Services Programs, CalFresh, and CalWorks. And on the California Department of Social Services, or CDSS, website, you can learn about benefits and services available in California, including assistance with paying energy bills and community services available to low-income households. Now, there are also a lot of nonprofits and community organizations programs that offer assistance throughout the Bay Area. To connect to these programs and services, you can call 211. This is a 24-hour, 7-day-a-week confidential hotline that helps people connect to emergency services like food, shelter, rent, and utility payment assistance, legal services, income support, and employment. You can also visit your city and county website to look for programs and resources that are available to people who live within their boundaries. The California Department of Community Services and Development's website can help you search for assistance services and programs in your area. And community organizations and networks that provide a list of resources. There's some that, there's online ones as well. For example, onedegree.org is a free searchable database to find up-to-date resources, including emergency services, food pantries, healthcare, housing, legal, and employment resources. Now, for programs and assistance, there are government and state assistance programs that help cover living expenses, including food, healthcare, and housing costs. Nonprofits and community agencies offer a variety of services for low-income households that include case management, emergency financial assistance, food, emergency housing support, and affordable rental housing programs. Many cities and counties also have their own programs to help people reside within their boundaries. For example, they partner with affordable housing providers to offer affordable housing opportunities to their residents, both for rent and for homeownership. And their websites also provide helpful information about various local resources and programs that are available in the county and or city. And some cities and counties also have resource centers that you can visit in person. Of course, right now they may be closed, but check out your city or county website to see if they do have those centers and what what their plan for reopening are. So let's talk about Cash Aid. Cash Aid benefits are public assistance programs that help qualified low-income households pay for housing, food, utilities, and other necessary living expenses. Now, CalWorks is also known as the Temporary Assistance for Needy Families, or TANF, and provides cash aid to eligible families that have children in the home to help cover living expenses. Now, eligibility requirements include income, assets, and also other factors. Part of CalWorks is the CalWorks Welfare to Work program, which is an employment and training program that's designed to promote self-sufficiency by helping recipients become employed. So anyone receiving CalWorks aid must participate in the Welfare to Work program unless they are exempt. Now, depending on the recipient's situation, it helps with job placement, education and training programs, and pays for expenses like transportation to work and training costs. And then the CalWorks childcare program helps parents who participate in the Welfare to Work program access immediate short-term childcare and pay for childcare expenses. Now, general relief is also known as, sometimes known as general assistance, provides relief and support to adults who are not supported by their own means, other public funds or assistance programs. So this program is funded at the county level, so eligibility requirements vary from county to county. The Refugee Cash Assistance Program, or RCA, it provides cash aid to refugees without children who are not eligible for any other cash aid. RCA also offers employment and social services to help refugees become self-sufficient. And the Cash Assistance Program for Immigrants, or CAPI, is a state-funded program designed to provide monthly cash benefits to aged, blind, and disabled non-citizens who are ineligible for SSI and SSB solely due to their immigrant status. And we'll review SSI and SSB in a moment. Now, Social Security is a program that benefits U.S. workers who contribute to the fund throughout their working lives. It provides replacement income for qualified retirees and their families. And it pays benefits to people who have already retired, people who are disabled, survivors of workers who have died, and dependents of beneficiaries. Now, retirement benefits, this is when Social Security pays a percentage of your pre-retirement income, and the monthly amount you receive depends on several factors, including your lifetime earnings and your age when you start collecting benefits. On average, retirement beneficiaries receive about 40% of their pre-retirement income, so you should not rely on Social Security payments as a retirement plan. Social Security is meant to supplement income, not replace it. So to ensure a financially secure retirement, it's very important to start a retirement savings plan as early as possible using savings accounts like 401ks or IRAs. Now, you can start collecting monthly payments as early as age 62 before your what's called your full retirement age, or FRA. Now, the year in which you were born provides a rough estimate of your FRA, which is going to be around between 66 and 67 years old. However, if you do that, the payments will be reduced. If you wait to collect them when you reach the full retirement age, then you'll receive your full benefit amount. Now, you can choose to delay receiving benefits beyond your full retirement age. If you do, the benefit amount will increase until you turn 70. But at age 70, the payment amount is maxed out and no longer increases. So it doesn't, to no one's advantage to wait past 70. Now, some family members may also qualify to receive benefits on the record of the person receiving retirement benefits. A spouse may be eligible if they're at least 62 years of age, even if they've never worked under Social Security. Biological, adopted, and stepchildren may also qualify. And child's insurance benefits are available to children whose parent becomes disabled or dies. And under certain circumstances, a stepchild, a grandchild, a step-grandchild, or an adopted child may also be eligible. And then survivor benefits may be available to widows or widowers, divorced spouses, provided the marriage lasted 10 years or more, and parents who are 62 years or older and were dependent on the deceased for at least half of their support. And here it is. I said we were going to talk about SSI and SSB. And so Supplemental Security Income, or SSI, and Social Security Disability Insurance, or SSDI, are government-funded programs that are administered by the Social Security Administration, or SSA. Now, SSI provides minimum basic financial assistance to older adults and persons with disabilities who have very limited income and resources. Now, persons who qualify for SSI automatically qualify for Medicaid, which in California is called Medi-Cal. Eligibility for SSDI is based on disability and work credits, not on limited income and resources. Now, this program provides benefits to workers who have made enough earnings contributions towards Social Security, or whose spouse or parent has paid enough towards Social Security taxes. and can no longer work due to physical and/or mental reasons. Now, persons who qualify for SSDI qualify for Medicare. To qualify for SSDI, the applicant must be fully disabled, and that means that they cannot perform any kind of work duties for at least 12 months because of their medical condition. Now, the application process is lengthy and it's hard to get approved. There are Social Security attorneys and advocates that can help understand the SSDI application system and with an appeal process should the application be denied. Now, the major difference to keep in mind between SSI and SSDI is that SSI's eligibility determination is based on age, disability, and limited income and resources, not work history. Whereas SSDI's determination is based on disability and work history. Now, in some circumstances, an individual may qualify for both SSI and SSDI. And now state supplementary payment, or SSB, is a program that supplements SSI benefits. This is distributed by the state of California. The state adds cash assistance benefits to SSI, but the SSI federal payment to account for the state's higher cost of living. Now, just like SSI, eligibility is based on federal criteria. And if a person qualifies for SSI, they also qualify for SSB and may also be eligible for CalFresh. Now, the California State Disability Insurance Program, or SDI, is a state program administered by the Employment Development Department, or otherwise known as EDD. It provides two types of disability insurance. Disability insurance, or DI, offers short-term wage replacement benefits to eligible California workers who are unable to perform their regular work due to a non-work related illness or injury, either physical or mental or pregnancy. Paid family leave, or PFL, provides partial wage benefits to employees who need to take time off from work to care for a seriously ill family member or to bond with a new child, and workers who participate in a qualifying event or an essential need resulting from a family member's deployment. Now, if you get hurt on the job, your employer is required by law to pay for workers' compensation benefits. Now, this includes getting hurt at work due to one event, like hurting your back in a fall, or repeated exposure, like losing your hearing because of constant loud noise. Now, the benefits can include medical care to help recover, temporary disability benefits if you lose wages because your injury prevents you from doing your job while recovering, and permanent disability benefits if you don't recover completely, vocational rehabilitation, and death benefits. Now, the Division of Workers' Compensation, or DWC, monitors the administration of California workers' compensation claims. Your employer must give or mail a claim form to the injured worker within 1 working day after learning about the injury or illness. Now, the form can also be downloaded from the DWC website. Connecting to affordable housing. Affordable housing programs are offered by the government, by nonprofits, cities, and counties. Now, unfortunately, here in the Bay Area, there just isn't enough affordable housing to meet the demand and the need, but don't let that discourage you from searching and applying, or even just adding your name to an open wait list. Below market rate, otherwise known as BMR units, do become available, and there are new housing developments being built to help meet the demand and the need. The housing voucher program, that is also known as Section 8, is the federal government's program for assisting very low income families, the elderly, and the disabled afford decent, safe, and sanitary housing in the private market. To apply for this program, you need to contact your local public housing agency, or PHA. It's true, many Section 8 wait lists are closed, but it's always worth it to check your local PHA's website to learn about their waitlist status. And if it is open, even if the waitlist is long, it's always a good idea to add your name to it. If your name is not on it, you for sure don't have a chance. Now, there are also various nonprofit organizations that build housing developments and rent the units at an affordable rate. Also, many cities and counties require private developers to designate a percentage of the units they build at below market rates for people who live or work within their boundaries. The best way to learn about local affordable housing opportunities is to visit your city and county website. You can also visit the California Department of Housing and Community Development, or HCD, for a directory of affordable housing developments by county, and HUD.gov for a resource locator that helps you find affordable housing resources near you. And as I mentioned earlier, the handout that you'll be getting has all these programs with the links. So, you know, we obviously we don't have time to go into each program in detail, but you can just look through the handout and it can link you up directly to the programs you're interested in. Now, there are two types of housing choice voucher programs, the tenant-based voucher and the project-based voucher. Under the tenant-based programs, the Public Housing Agency issues an eligible family a voucher, and the family selects a unit of its choice from a property owner willing to participate in the Section 8 program. If the family moves out of the unit, the contract with the owner ends, and the family can move with continued assistance to another unit. Eligibility is determined by an income limit that is set based on where you live and the size of your household. In addition, the property owner may set other requirements. Now, under the project-based voucher, a public housing agency enters into an assistance contract with the owner for a specified unit in a building designated as Section 8. The PHA then refers families from its wait list to the project owner to fill vacancies. Now, because assistance is tied to that unit, a family who moves out does not have any right to continued housing assistance. However, they may be eligible for a tenant-based voucher when one becomes available. There are also nonprofit housing developers like Mid-Penn Housing, Bridge Housing, EAH Housing that build affordable housing. And honestly, these are just 3 names I've mentioned, but there's others. This means that people who qualify for one of their units make a monthly housing payment that is affordable to them. Many have properties across the Bay Area and some even across California. They typically serve the low-income population and have income limits requirements. Also, some of the locations may be just for families or people 55 and older or people with disabilities. So you just need to visit their website and see what's available. Some affordable housing programs offer homeownership opportunities. Habitat for Humanity is an example of an organization that builds and sells homes at an affordable mortgage to qualified families with limited and moderate incomes. Now, there are programs that help people who are at risk of falling behind on rent with one-time rent assistance, and may also offer rent deposit assistance. Nonprofits and community services agencies offer these services, and to connect to a program near you, you can call 211. And the HUD VASH program is a collaboration between HUD and the Veteran Administration, or VA, and is available to veterans and their families who are homeless. HUD provides rental assistance vouchers for privately owned housing, and the VA case managers connects them to support services. Now, additionally, a subsidy called the Shallow Subsidy Initiative helps low-income veterans afford housing in high-rent areas by providing them with a fixed rental subsidy for up to 2 years. Now, for people who need to connect to emergency housing, coordinated entry access points like public housing agencies, emergency shelters, community services agencies, and nonprofit organizations connect people who are unhoused or at risk of becoming unhoused to emergency housing. Many of these organizations' work focuses on helping them connect to emergency shelter and ultimately transition to permanent housing. They also may provide food, clothing, medical care, and help with finding living wage jobs. The best way to find the closest access point is to call 211. Then once connected, the agency completes an intake process that determines which services and housing program best fit the individual situation. The information is then entered into a shared database, which is secure. And it's used by all participating agencies so they can communicate with each other about a person's case. The program works on a first come, first served basis, and those who are most vulnerable and the most in need will be connected to available housing programs first. Persons whose needs do not match the services provided by a housing program are referred to other services. The CalWORKs Housing Support Program offers CalWORK families that are experiencing homelessness or are at risk of becoming homeless financial assistance and housing-related supportive services like rental assistance, housing search, case management, security deposits, utility payments, moving costs, hotel and motel vouchers, legal services, and credit repair. Many utility providers offer programs to assist households when they cannot pay their bills on time. Companies may offer a payment plan or a temporary discount on your bill if you can pay some but not all of what you owe. Some companies also work with local and nonprofits to provide additional financial assistance to qualifying households. So you would contact your utility provider, explain your situation, and ask about options to help you pay. The California Lifeline program helps lower phone bill costs by providing qualified households discounts on home phone and cell phone services. And some people also qualify for free phones. And to apply, you would need to contact your local telephone company. People who are eligible for public assistance programs like Medicaid, CalFresh, SSI, and below market rate housing programs may also qualify for affordable high-speed internet service, and AT&T and Comcast both offer their own programs. And some nonprofits and community services agency offer their one-time utility payment assistance. To connect to those, call 211. That's probably the best way. Now, depending on your household income, you may qualify for discounted water services. If shut off of your water service is imminent, then you may also be eligible to arrange a bill payment plan. And you can contact your water utility company to see if you qualify and to sign up. So the California Low Income Home Energy Assistance Program is federally funded program that helps eligible low income households cover their energy costs through bill payment assistance, weatherization, and energy efficiency repairs. And it provides one-time financial assistance to help pay a bill and assistance to, in a crisis that could be deemed potentially life-threatening, like a utility disconnection. Now, in addition to help with paying the energy bill, this program offers free energy upgrades to help lower utility bills and improve health and safety. And local community services agencies help with the application process. And again, to find one near you, you can call 211. So 211 is really a great resource for connecting. There's a couple of programs the CARE program gives low-income customers a discount on their electric bill and natural gas bill. People who are enrolled in public assistance programs may also be eligible. And THERA is an energy discount program for households whose household income exceeds the CARE allowance. So to see if you qualify for one of these programs, then you would need to contact your utility company. And PG&E offers its own programs that can help save money and energy, like a one-time energy credit for up to $300, longer-term assistance, like their budget billing plan that averages your annual energy cost over the last 12 months to determine a monthly payment amount. Payment arrangements where you can spread out your owed balance over several months or get a payment extension. And the arrearage management plan to help pay unpaid bill balances. Medical baseline is for consumers who rely on life support equipment or those who have life-threatening illnesses or compromised immune systems. The program is not income-based. Consumers are billed for natural gas and electricity use at the utility company's lowest residential rate. Now, CalFresh is also known as the Supplemental Nutrition Assistance Program, or SNAP. This program helps qualified low-income people cover food costs. And as mentioned earlier, SSI and SSDI benefit recipients may also be eligible. The Women, Infants, and Children program, or WIC, is a free supplemental nutrition program that assists families, pregnant women, new mothers, infants, and children up to the age of 5. WIC participants get access to supplemental nutritious foods, nutrition education and counseling at WIC clinics, screening and referrals to other health, welfare, and social services. The California Food Assistance Program, or CFAP, is for qualified non-citizens who are legal permanent residents and who do not qualify for federal benefits. To get assistance covering your food costs, food banks provide free healthy food to anyone in need at food distribution sites. The food bank is the food warehouse, and then they distribute it to food pantries, which in turn distribute the food to their community. And to learn where the closest food distribution site is, you can contact your local food bank. And the one in Santa Clara County is Second Harvest. So you can take a look at their website. Food banks and food pantries also offers programs that feed kids even when school is not in session, and provide baby food, formula, and non-food staples like diapers. And food banks also can assist with CalFresh applications. And here's some information on just general assistance. The Volunteer Income Tax Assistance Program, or VITA, offers free tax help for assistance with filing tax forms, and is available to low-income households, persons with disabilities, and limited English-speaking taxpayers. VITA sites are generally located at community and neighborhood centers, libraries, and schools. There are also clothes closets that provide low-income families with free clothes, including shoes, winter jackets, school supplies, and work uniforms. These are run by charities, and they operate in most major cities and towns. So check your city or county, or call 211 to find a location near you. There are nonprofit organizations that offer free computers to eligible low-income households and programs that offer them at low cost. You can also ask your employer or school, because many have programs that provide free or discounted laptops to their employees and students. And there are services and programs that provide low or no cost health insurance coverage. Now, Cover California, most of you probably have heard about this, is a state-free service that connects Californians with brand name health insurance. Any Californian can get health insurance through Cover California if they are a state resident and cannot get affordable health insurance through a job. Medi-Cal and Cover California use the same application. Now, this means that once you apply through Cover California, you'll find out which program you qualify for. Medi-Cal is California's Medicaid healthcare program. It's a free or low-cost public health insurance program that provides healthcare services for low-income families, seniors, persons with disabilities, children in foster care, pregnant women, and certain low-income adults. Now, applications can be submitted through your local county social services office by mail or online through Cover California. The IHSS program helps pay for services to help California residents who get Medi-Cal and are over 65, disabled, or blind remain safely in their home. Disabled children may also be eligible for IHSS. Now, the types of services which can be authorized through IHSS are house cleaning, meal preparation, laundry, grocery shopping, personal care services, help with going to medical appointments, and protective supervision for the mentally impaired. Most people get services free of charge. A social worker assists eligible people in finding a care provider, which may be a family member, it could be a friend, a neighbor, or a registered IHSS provider. People who are approved for IHSS must hire their provider, so they're going to be the employer. And that provider who will perform the authorized services and are responsible for training and supervising that person that they hire. The Children's Health Insurance Program, or CHIP, is a state program that provides low-cost health, dental, and vision insurance coverage to children in families that earn too much money to qualify for Medi-Cal. And Medicare is a federally funded health insurance program that helps cover the cost of health care for people who are 65 or older and certain people under 65 with disabilities. Now, Part A of Medicare helps pay for inpatient care, for example, in a hospital or skilled nursing facility following a hospital stay. And Part B helps cover doctor's visits and preventative service. Now, Part D helps cover cost of prescription drugs, but that's something that you can add to Medicare. The Medicare Savings Programs, or MSP, provides qualified people help from the state paying the Medicare premiums. And in some cases, it may also pay deductibles and co-payments. There's also community health centers, also known as low-cost clinics, that are community-driven nonprofit clinics located in medically underserved areas or serving populations that are medically underserved. They offer a variety of low-cost services where payment is determined on the person's ability to pay. Services include medical, dental, vision, and behavioral health care. RotoCare Bay Area is a nonprofit that hosts free medical clinics throughout the Greater Bay Area, where volunteer medical professionals provide free healthcare services to uninsured persons who have limited ability to pay for medical care. There are also prescription drug savings program. Medicare Extra Help is for Medicare beneficiaries who have limited resources and income and pays for monthly premiums, annual deductible, and copayments related to Medicare Part D. There's prescription drug programs from the government agencies and pharmaceutical companies that can help you pay for prescription drugs. And to find programs, you can contact the pharmaceutical company, the California Department of Social Services, and local health centers. And our RX Assist is a nationally recognized web-based medication assistance resource center. You can use their database to locate savings for prescription drugs. And if paying for medicines is a problem, talk with your doctor. Ask if a generic medicine can be used instead of a brand name drug, or whether there's a similar drug that is less expensive. And the doctor's office can also serve as a valuable resource for patients for such activities as informing them about the Medicare prescription drug benefits, signing application forms for patient assistance programs, and referring patients to state-sponsored services and communities assistance programs. There are several resources and programs that can help people find a job or increase their earning potential. Some offer free career training, pre-apprenticeship and apprenticeship programs in high-demand fields. These programs also typically offer help with job search, like resume writing, interview coaching, and workshops. They also partner with local employers to provide job resources and recruitment events. Now, career training programs provide hands-on instruction. Pre-apprenticeship programs prepare individuals to enter and succeed in a registered apprenticeship program. An apprenticeship is an earn and learn program that provides workers with income while they learn on the job. American Job Centers of California are also known as one-stop career centers. They bring employment and training program services into one place, and they partner with local employers to help people connect to jobs. And services include help with creating a personalized plan, resume review, interview coaching, skills building workshops, and finding professional certificate training opportunities. There are also many websites where you can search for jobs, like Indeed.com, Monster, and Glassdoor. Just make sure you don't have to pay a fee, because it should not cost you anything to apply for a job. Job fairs are an opportunity for job seekers to speak directly to employers that might have job openings. They can be in person or online. Some have employers from a variety of industries. Others are smaller and more targeted to a particular audience. And you can Google job fairs near me or contact your local one-stop career center. You can also contact an employment agency. Some work with employers who want to fill full-time positions, but some match workers with short-term or temporary to permanent positions. And when you finish your short-term work assignment, the agency looks for another assignment for you. Now, these types of jobs can earn you money while you look for permanent work. You also gain skills and work experience and work references. And sometimes employers offer permanent positions to temp workers. The federal government offers many job opportunities for a wide variety of jobs. Here are some websites that can help you search for these types of jobs. On the usajobs.gov website, you can find government job opportunities. To look for California state jobs, go to calcareers.ca.gov. Calops.org is for people who want to apply for public sector jobs in California. And adjoin.org is for people who want to apply for jobs in the education field. People who are out of work or have had their hours reduced may be eligible to receive unemployment insurance benefits. And when filing for UI benefits, the worker must have earned enough wages during the base period to establish a claim and be totally or partially unemployed through no fault of their own, physically able to work, available for work, and ready and willing to accept work immediately. Now, if they quit, they must prove good cause for quitting. If they're fired, the employer must prove there was misconduct. Either party can disagree with the decision and file an appeal. Unemployment insurance recipients may also qualify for California Training Benefits, or CTB, which allow them to continue education, upgrade skills, or learn a new trade while receiving UI benefits. Now, UI recipients who are approved for CTB are excused from the requirements that they must be available for work, actively seek work, and accept work while they complete their education, upgrade their skills, or learn a new trade. They also may be eligible for training extension, which provides additional weeks of benefits while they complete their school or training. And here are some resources and programs for people who are 60 years or older. The Elder Care Locator is a public service that helps connect older adults and their families to housing and other services like health insurance, benefit programs, and transportation. The Health Insurance Counseling and Advocacy Program, or HICAP, offers free confidential one-on-one counseling education and assistance on Medicare. Your volunteer counselors can help you understand the beneficiary's rights and healthcare options. Benefitscheckup.org is a free online service of the National Council on Aging that helps find a list of programs near you that can help pay for medications, healthcare, utilities, and more. The Senior Community Service Employment Program provides training for low-income unemployed seniors. Participants also have access to employment assistance through American Job Centers. Participants work an average of 20 hours a week and are paid the highest federal, state, or local minimum wage. Tax Counseling for the Elderly, or TCE, provides free tax help to individuals who are 60 years or older. And Meals on Wheels supports community-based programs across the US that are dedicated to addressing senior isolation and hunger. Now, this network virtually serves every community in America. It provides friendly visits and safety checks to seniors, as well as home delivery or free or low-cost nutritious meals. So we are at the end of our presentation. Now, of course, I'm happy to stay and answer any questions. Again, as Nevin mentioned a little bit earlier, you're going to be receiving an email with a link to an evaluation form. This is anonymous. This form is anonymous, but it will give you an opportunity to give your feedback about today's presentation. We do read these carefully, and we really appreciate the feedback. You just need to basically follow the link, complete the form, and click submit. And I also would like to tell you a little bit more about our online financial education center. So this is a free resource that's available to you 24 hours a day, 7 days a week. And you can access this from your computer, your mobile, or tablet. It features a robust library of playlists that cover personal finance topics like budgeting, retirement planning, homeownership, banking basics, loans, credit reports and credit scores, and more. And you're also able to create a personalized playlist that's tailored to your unique financial goals and priority. With a quick account setup, you get access to a series of lessons that can be completed in just 3 to 10 minutes. And they're self-paced, they're interactive, and provide a fun and engaging experience. And you can start a lesson, clock out, go back in, so you can stop and start anytime you want. So it's really very, very accessible and completely free. Now, if you would like to meet with a HUD certified housing counselor for help learning how to manage your personal finances, or maybe improving or repaying credit or managing debt, starting a savings plan, you can find a list on the HUD website. As I mentioned earlier, Habitat East Bay Silicon Valley is a HUD approved housing counseling agency. So you can contact us directly if you would like to meet with us. At this time, we're only offering video appointments, but when we are able to offer in-person appointments, we will schedule them at our office. So if you would like to work with a counselor and have the option of meeting them in person when that's possible, then I would recommend that you connect with the one that's closer to you, which I'm assuming in this case that would be me, because I work in the Milpitas office and my colleague Ramel works in Oakland. So now I'm done with my presentation, and I'm happy to answer any questions.
Thank you, Alessandra. Thank you so much for the great presentation.
Yeah, you're welcome. This was great. Like I said, it's the first time I presented, and I thank you all for being the first people listening in.
That was great. Thank you.
Are there